Good afternoon, ladies and gentlemen, members of the media, Tobago media in particular, or national media, citizens home and abroad. A special welcome today to Tobago to a handful of Trinidadians who have been working very hard in Trinidad, Doctors Trotman and Doctors Miriam Richards, meeting your colleagues in Tobago today. Thank you all very much for coming out to yet another one of our briefing sessions on the management of COVID-19 and its challenges. I have online in Trinidad Chief Medical Officer Dr. Roshan Parasram and Dr. Hines, who would take us through our national perspectives at this time. So Dr. Parasram, welcome to Tobago.
Hey, good afternoon, Honorable Prime Minister, Honorable Minister of Health, the Secretary of Health for Tobago, all colleagues, members of the media, members of the viewing and listening public. So, as usual, we're going to begin with the COVID-19 update as of the 30th of July 2021. Both public and private facilities, we have conducted thus far 268,163 tests. Within the last 24 hours, we have received 310 new positive cases, taking our total positive cases up to 38,557. Total recovered patients now stand at 31,565, 5,922 active cases, and of those in home isolation, we have 5,220. Those in hospital are now 311, and those deaths now stand at 1,070, and again, condolences to the family of those who would have passed. Total patients in step-down facilities, 81. Those in quarantine facilities, 162. As it stands in terms of the vaccination status, 382,149 persons would have received their first dose of a WHO-approved vaccine, and in terms of our second dose, we stand at 191,881. If I could have the next slide, please, Ava. Yeah, so what we'll be going into briefly is, so the vaccination percentages for the entire population as of our graph, which would just basically summarizes what I said a few minutes ago. So starting on the left-hand side, we received at least one dose, 382,149, received two doses, 191,881, and persons that have not received a dose thus far, 1,022,161. Remembering that those under 18 account for about just under 400,000 persons, and for now, there are no WHO-approved vaccines in the country that we can administer that cohort. And also remembering one is considered fully immunized, fully vaccinated when 14 days has passed since their final second dose of a COVID-19 vaccination as per WHO standard. Next slide. So we just wanted to present some data as it relates to the hospital admissions, for beginning with the high dependency unit, as those persons who are partially vaccinated. And in that green portion of the pie chart, what we are alluding to are people who had one dose of a WHO-approved vaccine. They would have had a second dose. In this case, we had no one who would have had a second dose and admitted to an HDU. Partially vaccinated, in this case, is 9.6%. Unvaccinated, 90.4% of all HDU admissions, meaning that we had no fully vaccinated person in Trinidad or Tobago admitted to the high dependency unit. Next slide. So again, this is similar. It's the ICU admission chart. And again, partially vaccinated, 15.6%, meaning first dose or second dose. In this case, we had 12 persons, giving us a percentage of 12.5%, having a first dose admitted to an ICU, and a second dose, 3.1%. And just to explain a little bit more on what although you would have had a second dose, those individuals would not have been 14 days past their second dose at the time of their infection. So they would have been infected prior to completing and becoming a fully vaccinated person and being categorized as a partially vaccinated person. So that accounts for 15.6%, and the unvaccinated group, 84.4%. More importantly, there's no fully vaccinated individual in Trinidad or Tobago as well who has been admitted to the ICU at this time. Next slide. And the final slide as it relates to admissions, this is a slide related to deaths from COVID-19, includes deaths from May 14th, 2021 to present. Partially, as you can see, partially vaccinated refers to the same thing. First doses, number of persons, 22. Second dose, again, 5, 0.6%. But again, these are considered partially vaccinated because they would have passed away or been infected prior to completing the 14-day period and being considered fully vaccinated. So just to highlight again, fully vaccinated, there's no one at this time who has met the criteria of being fully vaccinated and has passed away from COVID-19 in Trinidad or Tobago. I'll just briefly give an update as to our media release. As of yesterday, we would have sent out a press release July 30th, 2021. You could come, Avery, next slide, or you could come off the slides for now. So as our release would have stated, the Ministry of Health advises that as of the 30th of July 2021, the WHO has indicated that the vaccine combination of first dose AstraZeneca followed by a second dose Moderna is approved. Trinidad and Tobago has therefore updated its list of approved COVID-19 vaccines and vaccine combinations to bring our list to the following. So as of now, in terms of entry into the country, we would accept, based on WHO approval, the following vaccines. Pfizer-BioNTech, 2 doses of that, first approved on the 31st of December 2020. AstraZeneca, first approved 15th of February 2021. The Janssen Johnson & Johnson vaccine, a single dose, approved 1st and 12th of March 2021. Moderna, approved on the 30th of April 2021. Sinopharm, approved on the 7th of May. Sinovac, approved on the 1st of June. And the combinations that we allow at this point in time: first dose AstraZeneca, followed by a second dose Pfizer, which was approved on the 15th of June 2021. And a first dose AstraZeneca followed by a second dose Moderna, which was only approved on yesterday on the 30th of July. And finally, by way of repatriated minors, just to give the country an update as of this time, as you know, the policy for unvaccinated minors, persons under 18, is that those persons are allowed to go home with a vaccinated parent or guardian. And there's a PCR test that is done 3 to 5 days after they come into the country. In addition to the PCR test that is done 72 hours prior to entry, we would have had 111 persons in that category, 111 children to date. And of those, we picked up 1 case on the day 3 to 5 swab that was positive a couple of days ago. So that's my end of my clinical update for this morning. Thank you. We go now to Dr. Hines, who will continue with the epidemiological update, and then the rest of the team.
Could we have Dr. Hines, please?
Okay, thank you, CMO. And good afternoon to the Honorable Prime Minister, Honorable Ministers, Honorable members of the THA, honorable colleagues, members of the media, members of the viewing and listening public. We're going to continue with the epidemiologic update as at the 30th of July, that is yesterday at 4 p.m. And as at that time, we continue to see that plateauing, that flattening off of the curve instead of the downward trend that we had previously been noting. We're seeing that at this point in the future bars, the bars remain largely the same height, and that blue line running through them that indicates the rolling average, that is actually approximately the same level or actually increasing a bit. And that suggests that we are plateauing, but we are having a little of an increase, a slow increase noted by this data at this point in time. If we take the same data and we aggregate it at the weekly level, at week-on-week basis, we see a similar trend. And that similar trend is that The bars for the month of July, those future bars over on the right-hand side, are largely around the same height. They are actually seeing a little bit of an increase from the 1 week to the next, looking at weeks 27 to 28, and then 28 to 29. Week 30, according to preliminary data coming in today, should end approximately with the same number, or very close total weekly figure to last week. So again, this is indicating that plateau that we are referring to, and we will probably see maybe a 1% or so decrease from last week's total to this week, if so much. Looking at that same data again on the monthly level, we are seeing the overall trend from month to month of decrease from May to June, another decrease from June to July. And we also note the background, that salmon color that we speak about, that points to the overall positivity of the samples. And that for the month of July overall lies around 27%. So the downward trend in that is noted, but we also note that that downward trend itself also began to slow within the last couple of weeks. Moving to the demographics, the cases between the start of community spread in July 2020 and the current time have demonstrated a fairly steady or consistent pattern, where the majority of the cases are in this 25 to 49-year-old age group. And the balance between men and women at this point in time is just about equal, 50% either way. Moving to the fatalities, we do note that whereas previously we would have seen a larger majority of males versus females, within more recent time, we saw that decrease from about 75% down to where it is right now, where there's still a majority male, but it's a slimmer majority, with 58% or so of the fatalities being among men. Again, the majority of them being in the age group above 60, and the majority of them having some form of pre-existing comorbidity, with diabetes, hypertension being the most common of those. Looking at the geographic distribution as at the end of week 28, so we're comparing weeks 27 and 28. If we look at this map, and then look at the graph to the left side of it, what we see is week 27 in the purple and week 28 in the gold or yellow bars. Just looking at the bars, we see that in several counties, there may have been a slight decrease in Caroni, decrease in St. Andrew, St. David, decrease in St. George Central, approximately the same in St. George East. But in some counties, we did see increases. So St. George West, there was an increase, slight increase in St. Patrick, slight increase in Victoria. Tobago had a decrease. Romero, slight increase. So some counties were decreasing, some were increasing, and that accounts for that more or less steady trend where we're not seeing a large increase, some places going down, some going up between week 27 and week 28. Looking at that at the community level, we see a similar sort of pattern, lighter colors than we would have seen in previous maps. And there's some areas, usually areas of denser population, having larger numbers. So we are keeping an eye on the counties where cases are going up instead of down. We are encouraging all individuals in all places to access the vaccines as quickly as possible. This is going to help with the slowing of the trends towards additional infections. And just looking last but not least at how our initial or original projections had been performing, we note that at the point in time around mid-June, we had made a projection saying if we continued along those lines, we'd have been following this red line here that was on a slowing trajectory. What we're looking at with the blue bars is that we've actually not exactly continued along that path. So we're seeing where the blue bars, instead of continuing downwards, have actually begun to get a little taller, and they've now met this the projection for June, the middle of June, and we're going to redo that to see what trend we're looking at this point in time. So whereas we had seen and we're projecting an overall slowing, we're now seeing where that slowing has flattened off, and we need to reproject to see where we may end up if we continue at the rate at which we are currently going. So with that, we just want to re-emphasize the importance of the public health measures in reducing the risk of transmission and reducing the rate at which the virus can transmit itself from one person to another by reducing the number of susceptible individuals in the population. And with that, I'm going to turn you back over to Dr. Richards for her presentation.
Good afternoon to the Honorable Prime Minister, the Secretary of Health, Ms. Tracy Davidson-Celestine, the Honorable Minister of Health, members of the THA and TRHA Health team, Dr. Trotman, and my colleagues who have joined on the Zoom call, members of the media, members of the viewing and listening population of Trinidad and Tobago. This afternoon, I'd like to present a status update on the hospitals within the parallel healthcare system. This information is as of 8 a.m. on this morning, July 31st, 2021. As Dr. Hines would have indicated, the rolling average has increased marginally over this past week. And of course, the rolling average represents the average number of cases over the last 7 days, and that's per day. And a higher rolling average would would represent an increased demand for hospital beds across different levels of care. This graph demonstrates the admissions and discharges, and you would have noticed that the space between the orange line and the green line has widened over the last week. And this represents an additional burden or additional number of patients within the parallel healthcare system. This graph demonstrates the breakdown between the admissions and discharges. And you would note that there have been a marginally increased or decreased number of admissions, but the number of discharges has been less. So that has resulted in an increase in the net. Actually, between last week and this week, we have noticed a 70% increase in the net admissions or the extra patients that would have been managed within the parallel healthcare system. And this has represented a different trend that we had noticed from or on about week 23, which was around May 28th or so, because for the first time we are now seeing an increased trend or an increasing number of admissions. And this ties in, of course, to the rolling average of the number of cases increasing as well. When we look at the actual number of COVID positive patients in the parallel healthcare system, we have also noticed a very slow, but there was initially a very slow but consistent decrease. However, we are now noticing a slightly increased number of patients. And as of 8 a.m. this morning, there were 399 patients hospitalized across the 16 facilities in the parallel healthcare system, 311 across the 9 hospitals, and 88 at the step-down facilities. Yet again, we see the trend of 3 times approximately the number of critically ill and severely ill patients versus those who are recovering. The occupancy levels, of course, we express as a percentage because it describes the number of beds being used over the total number of beds that are available. And this is a measure of the capacity of the parallel healthcare system to manage patients. Since July 15th, the occupancy of the parallel healthcare system has been under 40%, and as of today, it is currently 39%, with Trinidad at 38% and Tobago at 46%. This graph demonstrates the breakdown or disaggregation, as I just indicated. Trinidad and Tobago with a slow but progressive decline and currently at 38%. Tobago with an increase over last week at 46%. We also look at the capacity of the hospitals that treat the severely and critically ill patients to manage new cases of COVID-19. And in Trinidad and Tobago, we have been noticing that over the last 3 to 4 weeks, only 1 hospital of 9 tends to be above the 75% critical threshold. This week, the only hospital that is above that threshold is the St. Anne's Hospital. All other facilities and hospitals are under the 75% threshold, and that represents a capacity to manage patients. With respect to the 7 step-down facilities, there is only one facility, that is the Area Hospital Point Fortin, that is above the 75% threshold. So overall, 14 out of 16 institutions across Trinidad and Tobago are under the 75% threshold. With respect to the 3 levels of care, the ward level occupancy is at 37%. That is 4 out of 10 ward level beds in Trinidad and Tobago are currently occupied, while the ICU percentage is today 64% and HDU is at 58%. Yet again, we noticed that the average over the last month of ICU occupancy is somewhere in the vicinity of 80%, representing a proportion of critically ill patients, and the HDU average is in the vicinity of 70%. One of the indicators that we look at would be the number of patients presenting to the accident and emergency rooms in the traditional healthcare system. And there has been a consistent trend of a low number of patients presenting. And this morning, across 4 accident and emergency departments, 10 accident and emergency departments, there are 11 patients being managed. And this trend has been consistent over the last 3 weeks. The ambulance system, another indicator, has demonstrated a consistent decline in terms of the use. And for this week, the average use, meaning the average percentage of COVID-19 transports, was 30%. And of course, once the usage it decreases, the turnaround time would decrease, and it's somewhere in the vicinity of 120 minutes on average. So, in closing, we would like to urge everyone to continue to practice these 3 W's. And also, we would like to urge all members of the population to please be vaccinated. Vaccination is our only tool in the COVID-19 review wards. Thank you very much.
Thank you very much, Drs. Parasram, Hines, and Richards. At this point, I would like to share in Tobago in her capacity as Secretary for Health. So, Mr. Davidson, could you introduce your medical team and let us get a report on the situation in Tobago?
All right, thank you very much, Prime Minister Dr. Keith Christopher Rowley. Let me also recognize Minister of Health. Take this opportunity to recognize members of media who are present and also the listening public who are also listening for information. I want to take this opportunity to also recognize the team that is here with me. One, County Medical Officer of Health, Dr. Tiffany Hoyt. There is also Medical Chief of Staff responsible for secondary care, Dr. Wheeler, Victor Wheeler, Acting Primary Care Manager, Dr. Roxanne Mitchell, and also Dr. Thompson, who works out of the office of the County Medical Officer of Health and who would provide us with research and statistics. Before I introduce the County Medical Officer of Health and her team to the microphone, I just want to share some thoughts with you, the members of the public, and that is to indicate that today we kicked off our mass vaccination drive at Shaw Park. And I want to first and foremost commend all of the partners in this exercise, the private sector, that would be NGC, Tobago Channel 5, Pulse Radio, and then of course members of the governing team through the Office of the Chief Secretary. We had TEMA, and then the TRHA and the Division of Health, Wellness and Family Development coming together. When I visited somewhere around 12:30 today, there were approximately 300 persons who would have come to the facility to receive vaccines at that time. And we're hoping that after lunch, the numbers will continue to climb. I just want to indicate that we are also looking at another site that would be in Tobago East as well, because as I would have communicated to you, the members of into our health facilities to access the vaccines, persons driving to our facilities to access the vaccines as well, and there may also be persons who would request appointments. So what we are doing is basically possible. You would recognize that over the last week or two, we have been having consistently high positive COVID cases on the island, ranging in the vicinity of about 35 or so on a daily basis. And of course, we know that is really not a very good trend. But at the end of us to be vaccinated. And that is why from the Division of Health, Wellness and Family Development, we have since reached out to the churches. We have had about 30 or so churches signed on to one of our discussions. And we have since had a discussion with about 22 or so youth organizations, of course, asking them and encouraging them to use their influence in the churches and, of course, in the youth groups to get as many persons vaccinated. Because when you hear from the County Medical Officer of Health, one of the things you would recognize is that quite a lot of our young people are very intent on strengthening our approaches. Our greatest challenge on the island, we will expanding our ICU capability. There is a significant chance that there would be more ill persons as well. And so that will skills at various levels in order we are very intent on skills at various levels in order we are very intent on ensuring that we work collaboratively to give her presentation and then
afternoon, Honorable Prime Minister, afternoon to Minister of Health and Honorable Secretary of Health, to my okay, thank you. So as of 10 p.m. yesterday, we would have recorded a total of 35 new cases. So that brings us to a total of 431 active cases currently in Tobago. We unfortunately also had one death yesterday, and now we have a total number of 43 deaths on the island. We want to extend sincere condolences to all families who have lost their loved ones. We had 10 persons discharged, and currently we have 382 persons in home isolation. Out of a total of 10,319 samples, which would have been submitted for testing. One of the things I would like to share is that I know when persons have been seeing the high daily numbers, the highest number of cases we've recorded thus far in a day, and I can share that one with the Trinidad and Tobago Fire Services, 2 with the port, 27 of those 52 cases. Around at it, we realized that predominantly on this date for Tobago.
All right, we now hear from Dr. Roxanne Mitchell.
Good afternoon, Dr. Parasaram and my colleagues. Good afternoon, everyone, media, ladies and gentlemen. I will be brief today. With regard to our home isolation, as Dr. Hoyt would have alluded to a short while ago, a month or so, is that we have had to intervene in about psychological intervention, 12%, 22% of those persons, and then 42% isolation to ensure that you stay at home, social interventions for you, psychological, and once we find it difficult to contact, there are persons who are not answering their home isolation. You are to stay in well-ventilated rooms. Open your windows. You are to drink sufficient fluids on a daily basis, mainly water. Of course, your coconut water for those who choose to go that route. Get sufficient sleep and rest. Relate again, like I said, any challenges you may have to the person that is monitoring you so we can provide timely interventions. You are to eat on a regular basis. Ensure you have sufficient intake of your fruits and vegetables. To all of the 2 persons within the household. Ensure you clean whether it's all the common areas, so the living room area, dining area, especially your bathroom areas. We also encourage persons as much as possible to get as much exercise as you can going forward. And just to run the presentation for today, sorry. Over 8,000, approximately 8,500 vaccines for the month of July, and that will be down from 9,508 the month before. With regard to healthcare workers, a total of 1,050 healthcare workers, which makes up about 64% of the healthcare workers on the island, have been vaccinated thus far with at least one dose of vaccine. And as the Secretary indicated a short while ago, 21 to 28 days. Additional health centers have come on stream. We are going to have them on a phased basis. Of course, this is limited by some logistics that we're working on, but we have ramped up at additional health centers. We are still vaccinating special groups. And as the Secretary said a short while ago, we are doing appointments. We do have walk-ins. And of course, now that we've introduced the drive-through, you have accessibility to vaccines. Regards.
Mr. Terence Dalsing to give us the national perspective on our vaccination program.
Thank you very much, Honorable Prime Minister. Good afternoon. Good afternoon to Tobago. It's good to be here. My colleague, Secretary for Health, Wellness and Family Services, Mrs. Tracy Davison-Celestin, Chief Medical Officer, and all members of the medical team from both Trinidad and Tobago. Ladies and gentlemen of the media, good afternoon. So, today, it is my duty to report on the national vaccination drive. We would have set a target together as a country to have 188,900 persons fully vaccinated by July 31st. It was a target that we set based on the vaccine availability that we had at the time. We have actually met the target a couple days early. To date, we have a time period that follows the administration of their second dose. What is important about at the start, ICU and HDU capacity for the vaccinated and unvaccinated, it means that 194,710 persons have a 99% chance of not dying from COVID, and have almost 388,805 persons represent 28% of the country's population. It sounds good in theory, but when you flip that, it means we have 620,000 persons still to embark on that journey to vaccination. So, whilst we are happy to have met the targets and are on the way to be fully vaccinated, the horizontal purple line represented the target that we were supposed to hit by July 31st. We have actually, and from Saturday the 24th, we literally averaging around 15,000 per day. From the 21st to the 23rd, for the past week, we are averaging 7,000 to 8,000 shots per day. That is less than 50% of where we ought to be. So August has to be a huge month from today, because sites are open today, they are open tomorrow, they are open Monday. We want to appeal to everybody providing personal services, domestics, categorize them, hairdressers, barbers, nail techs, persons who do facials, masseurs, all these people who provide personal services who currently cannot practice their trade. We urge you, this is your time. August is your month. Come out and get vaccinated. We also want to make a special appeal, although the response has been pretty decent from the retail sector, but we could do a lot more. All the stores, we still have to mop up some food and beverage. We still have to mop up some in bars and casinos, figures up to around close to 15,000 shots per day as possible. All politicians, whether you are a THA rep, a MP, a councillor, we know how to mobilize people and provide transport for people, for elections. I am asking everyone now to bring that same energy we bring to elections to vaccination. Because when we visit the sites and when we visit people, one of the complaints we are getting is that people want to be vaccinated, but they don't have transport. Store owners, chambers of commerce, religious leaders, MPs, THA reps, everybody drive-thrus. In both Trinidad and Tobago, and I'm glad to hear my colleagues said they are doing it, we are engaging places of worship, because people like to feel comfortable. RHAs, where you can come and be vaccinated, say a prayer, seek guidance from your Creator. No appointment. There is reach, there is accessibility, there is convenience through mass vac sites, 3 drive-throughs. Let August be a huge month for vaccine. Going to get another 200 to 250,000 persons administered with the...
Mr. Dayal Singh, I took the opportunity to spend this short time here in Tobago so as to introduce once again a team of experts, professionally trained, who are ensuring that the population in Tobago, the main reason for this is because area where data hiding in Tobago and Tree, as I am not some very differently from the address to the Prime Minister, but what benefits will in the law. Now what did those and its variants around the world is that those persons who have been vaccinated have not been feeling the harsh effects of COVID infection, meaning having been infected, getting serious symptoms getting to critical stage requiring hospitalization, and in the hospital, some people requiring intensive care and some requiring high dependency care in such units. Those persons who are vaccinated avoid the hospitalization, the strong symptoms, and of course, at 99%, as the minister would have said, chance of not dying from the virus. On the other hand, we are seeing in a lot of countries fourth wave arrangements, even in those countries that were beginning to think that we had gotten past the virus, hadn't got over it, had high levels of vaccination. We are seeing that some people have had to get back into restrictions, lockdowns, strict arrangements for movement of people, and so on, and worse, overflowing hospitals with sick people requiring care. Now, it would be unwise, if I choose that word, knowing that, to expose ourselves, putting our finger into that wound to be able to feel that pain. I think Dr. Hines, our statistician, has kept us up to date on this for over a year, showing us how the exposure of the population, the movement of the population, how it translates into greater infection levels, and how greater infection levels result in a wider number of people being sick, and of course a larger number of people dying from the virus. So the choice that we have to make at the wider national level is vaccinations, vaccinate or not vaccinate. On the healthcare side, we have to determine whether we move out in largest numbers, because I have not heard one person say to me, okay, roll back X and roll out Y. It's always about X alone or Y alone. But whatever we do for one set of people has an effect on another set of people in the country. And I dare say that the government is the agency that has the responsibility to look at the interests of all the people. So the advice coming from one sector is heard, we take it on board, but we have to see how that advice affects the wider national community. So we take Tobago again. If we take the advice of opening up everything in Tobago because Tobago hospitals are not full, because there aren't too many people walking around complaining that they have COVID, but the numbers are showing us that there's an increasing level of infection in Tobago. If we do that against the cautious management that we are following, we are almost guaranteed to have an increased level of infection in Tobago. And an increased level of infection in a small population literally explodes, because the contact between the numbers would be even greater, because in a smaller population, your space and your contact is greater. So we know if we remove the caution that we have now, that the outcome is likely to be greater infection. And I want to point out something to you that I said, I think 2 or 3 weeks ago when Dr. Hines raised it with us. If you look at the level at which we are at in that semi-plateau that is pointed out, it's at a much, even though it's not increasing to scary levels now, but it's at a much higher level than it was in March and early April. So if we begin to have increased infection at that level, it doesn't take very long to get us back to the peaks of June and higher. And that is what we have to avoid. So while there's inconvenience still, I want us to appreciate that as a country, in the face of the inconvenience and the calls for more, that we have in fact done quite a lot. And we've got the construction workers out, we've got transport workers out, we've got the largest groups. We brought people out in large groups. And those large numbers who are out conducting their normal life result in the level of infection that we have now that we're middling with. And as we add more people out, what we are seeing is a slightly higher level of managed infections. So every day you hear confirmations of about 250, 300, 320, thereabouts. We could easily move from that to scary numbers. And that is what we are trying to avoid. So I want to ask you to appreciate what we're doing, appreciate what we're having, appreciate what we're living with, because that is the best side, the better side of the coin. The other side of the coin is try to get too much more. And the only alternative to that, if you try to get too much more, is to find ourselves having to take rectification action later on, which we must avoid at all costs. The government is focused, and I myself am personally focused, on being in a position in September to have children go out to school. That will not occur if at this time we change around the method of cautiousness that we're following and have high levels of infection at the end of August. Then we cannot then look towards bringing children out in September. What we have to do is to bite the bullet now and keep, at worst, the plateau that we have now, with that very slight movement up or down below the projections, and better still get it below that. And if we are down there, then we could look towards making that major shift of having children go to school in September. It is not in September that we will be able to say, let's do something in September to have children go to school in September. It's long before September, which is now, that we have to keep holding the line to be in a position at the end of August to be talking about school children in September. So let everything happen, because not everything could be all fall down. We're trying to avoid that at all costs. And I also wanted to make the point to those who are not prepared to accept what the country is doing, that in Tobago, we have properly qualified health staff in Tobago, and we're not running a foul coup here. We have very good qualified doctors here. As a matter of fact, I myself got infected in Tobago, and I sat here in Tobago throughout my entire period in the hands of the Tobago doctors. It would have taken 20 minutes to get me to Trinidad by helicopter. That didn't happen, because I trust the level of healthcare available to the people of Tobago, and I dare say it is as good as or anywhere else in the country. So let's just continue along that road. The one group that we have not allowed to come out to do their normal business in this situation, I asked the minister and his team to call out the personal care delivery, personal services people. If you are involved in providing personal services, if you are working in people's homes, helping in the garden, those kinds of things, go get yourself vaccinated. Because once we understand that you're vaccinated, in 2 weeks, thereabouts, we can ask you to come out to work, because we would have been confident that a fair amount of you would have been vaccinated, and then we will then be able, if things are okay, to allow you to come back to do your duty for your family, have your earnings, and bit by bit we are all better off in the process. And also, if the retail stores heavily vaccinate and can confirm that with us, on the strength of the level of vaccination that we are doing, we will cautiously add more people and take a little more risk going forward. And I ask and I appeal for that to happen, because that's the last group we have. With respect to our friends with the bars, we have a good idea of what's going on. Don't think we don't know. But the bars sell alcoholic beverages and others. All those beverages are available in the supermarket. You can buy it and carry it home and drink it. What the bars offer that you don't get at home, buying it and carrying it home and drinking it, the bars offer socialization. That's the only difference. You can buy as much alcohol as you want in the country now, and you can drink as much as you want responsibly now. That's not prevented. What is prevented is the socialization that goes with drinking at bars, and it is that socialization that is the threat to us, and that is why the people at bars have been so long left out. And it's been long, it's been expensive, and today I will commit to asking the Minister of Finance to see what assistance, what greater assistance we can bring to the people who earn a living at the bars, especially the employees. I know we have a problem there because there are a special group of employees. Many of them have no record of employment, and many of those same people you hear calling for bars to be open, they do not protect their employees. That make it easy for us to find out who has been employed and therefore how the assistance can be had. We will still work on that, and I'm hoping that the Minister of Finance will be able to find the qualified people in there and provide some assistance. But we can't increase the socialization to drink, because it's too important at this stage and it threatens too much that we have at stake. But we'll try to see where we can help and work with the Bar Association to see how we can help in that situation. So that goes there. But it brings me to the point of vaccination. Before vaccines were available, that's in 2020, what we did and were doing was keeping the population sufficiently covered by the protocols we were following, and also restricting our exposure to the virus as far as we were able to. And that manifested itself in the border closure, the wearing of the mask, the lockdowns at home, and so on. We've passed that stage. We are in 3 different phase 2 now. Phase 2-1, phase 2-2, and phase 2-3. We are in the stage now where it is known to the vast majority of people in the world. Not everybody agrees, because there's nothing in the world that everybody agrees to. But in the scientific community in the world, it is now accepted that the best response to the virus is a vaccinated population. I don't know that I'll get too many arguments from scientific colleagues from that. I think that is now a fact on planet Earth. Population exposed to novel coronavirus. Coronavirus killed 4 million people and can kill many more. But we have now come to the conclusion that the vaccines that have been developed in 2020 and are being developed along the way, that those vaccines, especially as the case of Trinidad and Tobago, we took a policy position, the government of Trinidad and Tobago, in protection of the people of Trinidad and Tobago, that we don't see the vaccines before they come to you. We don't make them, we don't test them, and so on. So we rely 100% on the expertise of the WHO and PAHO, where we have membership and have had that for decades. PAHO has been supplying this country with vaccines. Many of us sit in this room were vaccinated by that arrangement without too much query and qualms. And in the case of COVID-19, PAHO is still there overseeing what we do in our vaccination program. And WHO is overseeing the world's response. And we said that any vaccine or any product or any protocol approved by WHO, we will subscribe to as a member of WHO. So today, we have even gone past the point of no vaccine. Because in the first quarter of 2021, we had very little access to vaccines. Very, very little. But today I can tell you that in our population of 1.4 million people, that's the target we're looking at, we set out, the science tells us that we need to vaccinate 900,000 of those people. To date, we have put our hands and have in our possession approximately 1.2 million doses of vaccines. The vaccines that we have in hand are all 2-dose vaccines at this time. So 1.2 million doses mean that we have had in our hands vaccines to handle 600,000 persons. That is a major hurdle from not having any vaccine. We in Trinidad and Tobago had or have vaccines to vaccinate just under half of our population. Now, if we do a little arithmetic, if we say that we have vaccines for 600,000 people, and very many people are out there either knowing or asymptomatically not knowing that they have COVID, but they have COVID among them in the population, a certain amount of natural immunity is taking place in the population. Persons who have it get over, didn't even know they had it. But if you check them, you'll find that the body would have developed some immunity to a virus that they didn't even know they had. And a rough estimate of that happening without any intervention is approximately, let's say, and for the mathematics that we're going to work, let's say approximately 200,000 people in the population of 1.4 million have in fact or are in fact immunizing themselves naturally, not needing a vaccine. So we add that to the 600,000 that we have. So therefore we cater for 800,000 people. Still means that we have another 600,000 to deal with. And if we take out 400,000 from that 600,000 as under 18 children and up to 18 who are not to be vaccinated, then we're looking at approximately another 200,000 people who are not covered by not being young or not self-immunized or not vaccinated. And then it also means that if we have 200,000 people to vaccinate over and above what we have vaccines in hand for, it means that for 2-dose vaccines, we need another 400,000 vaccines to cover those people. Or if we get to a 1-shot vaccine somewhere along the way, you can figure that out, 200,000 vaccines or thereabouts. But in a 2-shot vaccine system, we'll need 400,000. So we still need a substantial amount of vaccines down the road. But at this point in the road, we have in hand, Minister, how many vaccines do you have in your hand?
Right now, in Sinopharm, we have another about 500,000-600,000 to give out. So with Sinopharm, we have another 500,000 or 600,000 doses to give out. AstraZeneca, we are down to about 15,000-20,000 doses, but those are reserved for people to get their second shot.
So we do have just over 600,000 vaccines in hand. Some of it is the second dose, persons who have already got the first dose in one brand, and a lot of the others as for those who already got the first dose, like me, and to be vaccinated in Tobago. And there are those who are still yet to get their first dose. But to have in hand 500,000 doses of vaccine is not helping us fight. It's not helping us until those vaccines get into human beings. They play no role in the fight. And that brings us to the point of the vaccine hesitancy But before we get there, we should talk about the variants, because the COVID and its variant that we are familiar with, which is the original COVID-19, original, and its P1 variant, we know that because we've had it here. You saw what the P1 did to us. Outside of Trinidad and Tobago is the Delta variant, which so far we have not in our gene sequencing been able to identify, and we are taking it to mean that it's not here. It doesn't mean it's not here. It may also mean that it's not here in any large quantity, and therefore we have not picked it up yet. But let's for the moment say it's not here because we have not been able to confirm that yet. But the world around us is awash with it, and it's very likely that that Delta variant will get to Trinidad and Tobago. And what is the science saying about it? It's saying that it is many times more infectious than the original COVID. It's producing far more viral load, which means that it can infect people far more easily. I want you all to remember what happened between Australia and New Zealand. One person came from New Zealand, passed through an airport in Australia, and persons passed through the same narrow corridor that that person passed through, got infected, were picked up in Sydney, and in a matter of days, Sydney was largely closed down. And Australia literally had to reverse itself on all the progress it has made, because the Delta variant is so infectious. So understand that if it does come to Trinidad and Tobago and meet unvaccinated people, we cannot wish away the bad outcome of that. But heaven forbid, we are given a breathing space to do the best that we can do with the situation, which is to get vaccinated now. Just in case that virus comes here, you will be the person saying, thank God I'm vaccinated. Even if I get infected, I should be able to do better and survive, because the scientists are telling us, as you heard our scientists tell us today, so far, no person who has been vaccinated, also saying that even with the dreaded Delta, that the vaccination that you can do now will improve your performance as an infected person if you get infected by Delta down the road. So what in heaven's name would want you to be playing Russian roulette out there, not wanting to be vaccinated? We also, I didn't mention a group of people, and there are a number of good reasons. One of the good reasons I got last week is that pastor tell me don't do it. Because the belief in your religion is that's between you and your God. And if your pastor tell you don't do it, but what the pastor didn't tell you at the same time, ICU and high dependency care, and I don't think that is what he really meant. So today, there's one other group of persons I want to talk to from this platform here. And it's a specific group of politicians in Trinidad and Tobago for whom this country must fail, so that they could say, I told you so. As a matter of fact, I shouldn't say I was surprised, but I was very taken aback during the week when I heard somebody on a radio program reading out some misinformation about our gas supply and our future in the gas business, and had a good enjoyment in saying that the government is wrong. We are going to hell in a handbasket in the energy sector with respect to gas supply because BP says so. And I wonder if these people live here, and I wonder if they really so want to succeed or see others fail that they would like to see the country's business being what it is. But today, I heard the Minister of Health speak to. I asked all the people in the cabinet who represent people, the same way you organize and mobilize them to come out in rallies and so on, which we haven't had for a long time in this country. Go out there and mobilize people. Transport them to the vaccination stations. Go into the communities that you go for the votes. And the same way you go in there and meet them door to door, go there and vaccinate them door to door. The vaccines are available. But you see, those who are promoting vaccine hesitancy, by first and foremost telling the population about a particular brand of vaccine could be that we are guinea pigs. Or secondly, that the vaccination is about you traveling as tourists. People of Trinidad and Tobago, the vaccines are first and foremost about saving your life. And if you have a life, then you could be a tourist after. The vaccination program in Trinidad and Tobago with WHO vaccines are to help you fight an infection that is probably going to be deadly, more than likely will be in our population, but when it does, if it does, you want to be a vaccinated person at that time. So countries making decisions about who could come in and who could go out, depending on what brand of vaccine they would have, that will vary from time to time, you know. And in any case, we have been living with that all along. I've been working and traveling for the last 40 years, and I could tell you every decade I've had to be vaccinated to go, whether I was going to Africa, I was going to Europe, wherever I was going. Part of the travel arrangement meant that you had to meet some kind of vaccination program. In Trinidad and Tobago, because we have yellow fever in our forest here and in our monkeys, if you leave here going somewhere in Europe, they tell you have to get the yellow fever vaccine because your country has it. Some countries have rabies, and you have to have certain things in place. We don't let dogs come to us from Britain, from the United States and elsewhere in the world. I say it again, the only difference between now and the previous vaccination period is Facebook, where everybody, intelligent and idiotic, is an expert. So please, I'm appealing to the people of Trinidad and Tobago. Use the hundreds of thousands of vaccines that we have in hand now. Use this period where we are not reporting the Delta virus to get yourself protected. Mama, papa, child, young people, take your elders out and get them vaccinated or them. It's as straight as that. I have seen one particular situation where a home in Trinidad had a certain amount of elderly people experiencing elderly care. And COVID went in there and wiped them out. They didn't make the front page news. Some people think they're expendable. But the 1,000-odd families who are talking about who they lost and how they lost them. And then the frightening thing is this. The Delta variant is affecting young people in a serious way. So if it's on the way to us, because it's all around us, understand that it is not the same as January last year or March last year when COVID-19 came to us and many people were getting it and overcoming it. And of course, Dr. Richards tells us we do have some space in the hospital. We don't want to be having to use those spaces. Because if we have to use them, we may not be able to turn off the tap in the way that we would want to. Because we are a small population, we live cheek by jowl in many communities. And we therefore have to be serious. And today I am appealing to the average person in this country to use the vaccines that we have. We have now, because of how we've handled it, we've avoided the rush to the open stations. We have taken out large sections of the population and vaccinated them group by group. We've done that. So we can now say the stations are open to all, and therefore we don't expect any crushing crowds, but we expect you to go there at a steady stream. And the earlier, the better. Tomorrow is the 1st of August, Emancipation Day. Make a resolution to emancipate yourself from COVID by getting vaccinated and be alive for the next Emancipation Day. And keep your grandparents and even your middle-aged people alive and well, because every time we add to that number of 1,000 plus, these are citizens who, in many instances, no COVID, they would have been alive. So let us prepare for the eventuality of the Delta variant coming to us and dealing with what we have with us, because the P1 variant is already a dangerous virus taking some people to crisis. Let us not skylark during this period. This period is a very valuable period. And finally, I want to tell you that this concept about for those who are encouraging vaccine hesitancy, who should know better? Talking about expiration of the vaccines that the government has. And the government bought too much vaccine, we should have bought it in batches. People of Trinidad and Tobago, at one time, we couldn't get any vaccine at all. We placed orders, and the orders were accepted on the grounds that we could get a batch now and a batch later. But it appears as though some people would have preferred if we got a batch and then that ran out and we had known, because that in early July, we were in that situation. We would have used up what we had, but I did tell you that there would have been a narrow period when we wouldn't have had vaccines for first dosing. But after that, going forward, we should be able to have a constant stream of vaccine for first dosing. We were fortunate because of Trinidad and Tobago's relationships outside to get a substantial batch of a WHO-approved vaccine, which is now in hand. So nobody could say now in Trinidad and Tobago that I want to be vaccinated. I don't know where to go. I don't know who to turn to. And I don't know that there's any vaccine available. This country is not in that situation. We are in the opposite situation. Every responsible citizen or person or guardian who is responsible for somebody else who wants to get vaccinated, we are in that position now where we can get them vaccinated. And we must get vaccinated as quickly as possible. Because remember, you're not fully vaccinated until after your first dose. You allow that period to expire, and you get the time when you have your second dose, and then 2 weeks after your second dose, that's when you are supposed to be fully immunized. So let's look at August. If we start out after Emancipation Day to get vaccinated, the vaccine that we're using now has a 3-week period of waiting. That means by the 3rd week of August, you're ready for your last shot from that 500,000 doses of vaccine that we have. And then 2 weeks after that. So by September morning, if you vaccinate early in August, by the time the school should open in September, approximately half of the target that we set as a population should have been vaccinated, and we expect to get some more vaccines during August to keep the program going. So we're making progress going down the road. And that is the plan that we're following, and I trust that I can continue to rely on the good sense of the population in Trinidad and Tobago to agree with the rest of the world that a vaccinated population is in the best position to respond to COVID and its variants. And I also sadly have to report that we know that if you are unvaccinated, that you are more exposed to getting the worst of this pandemic. And the decisions that we are making in managing the movement of our population is to get the best outcome in a pandemic. 2020 is still a pandemic year. We are alive when the pandemic is taking place. 2020, 2021. Let us all try and be alive when 2021 is over, because we have sensibly responded. And the response that is available to us, not to prevent us from getting infected, because we know. I've heard some people say that the vaccines are no good because they're not preventing you from getting the virus. Well, if that is the best that science offers, if you are drowning and a log turns up in the middle of the stream, you're going to still get wet. But the log gives you the possibility to breathe and not be sucked under, and it might even take you to the bank. The vaccines reduce the infection rates, that is known. It also allows the infected to survive better. That's what it does. So do not reject the vaccine because it's not preventing you permanently from being infected. Some vaccines and some microbes, that happens, some viruses, that happens. When you get vaccinated, it prevents you for life. But if that's not what is available now, what you going to do? Say because it's not behaving like the yellow fever vaccine, you're not going to use it? And if this virus stays around, we don't know how long it's going to stay around for. God forbid, it could be around for years. Just remember, when we started dealing with COVID-19 in late 2019, we were talking about May of 2020. And when we started dealing with it in 2020, we were talking about May to September into the second year, and the virus has not receded anywhere in the world. Even where we thought it had receded and came under control, it is now, people are now reporting fourth waves. And in fact, as we have seen in previous pandemics, the later waves can be more deadly than the early ones. So it's running true to form. So Trinidad and Tobago, we have done quite well responding to this virus. And the reason why we have been able to do so well as a nation is because the population of Trinidad and Tobago had at an earlier time invested in a group of young people in the medical fraternity and other specialties who today are standing between us and this virus in 2021. So I want to continue to thank and congratulate our health staff in Trinidad and Tobago, and particularly here in Tobago, and all your support staff. Don't listen to the old talk. Old talk is a natural phenomenon in Trinidad and Tobago. And there are some people, the less they know, the louder they talk. There's one particular ex-minister who is on a platform regularly now, bad-mouthing the health system, bad-mouthing the national effort. He's a friend of mine. He and I are very close friends. I had to block him recently because he was annoying me. He was annoying me because he kept harassing me on my phone, giving me advice that is unsolicited, then goes on platforms and talk a lot of stupidness. I have work to do. I have people to care for. When I had a request to meet the opposition leader, the very next day I met with her, she brought two doctors. She brought two doctors, elected members of parliament, one of whom is my friend. They made 2 points to me as Prime Minister in that meeting. 2. One doctor, gentleman as he is, he inquired as to whether our health staff in all the hospitals are up to speed, whether the ventilators are available and in working order, and so on and so on. Because at that time, there was no treatment, and we didn't know where COVID was going. That doctor asked about whether the hospital, from that standpoint of infrastructure and personnel, was, and I had to report that yes, we had done the best we could and we were doing the best we could and so on, and we were ready to respond. The other doctor was insisting that what the government should do with COVID is to buy a shipment of hydroxychloroquine. That was exactly at the time when the WHO was warning the world not to use hydroxychloroquine because, one, it wasn't effective, and two, it was damaging. But that was his advice. And up to recently kept insisting that we must use hydroxychloroquine. So one mad person was recommending sunshine, one recommending hydroxychloroquine, and of course the other one telling you about guinea pigs and vaccines and so on. And that is the alternative. I could tell you today, Trinidad and Tobago, with all the criticism being made about the effort this country has made and the progress we have made, none of the alternatives being put forward would put us in a better position. The last request I got is that the health team now has shown that they are tired and they failed. Get them out and put a new team in. That is not going to happen. Because they are there by virtue of being our specialists in virology, our specialists in epidemiology, our specialists in all aspects of healthcare specific to this problem. It would be crazy to think that, okay, well, we didn't perfect it. We haven't killed off COVID. So the thing to do is to go and get a taxi driver or a fruit picker or a prime minister to go and take over the hospital. Crazy. Comfort yourself in the fact that in Trinidad and Tobago we made the investment and it's paying loud dividend now. That is why we could be doing what we're doing now. Talking to you, as I dare say, one of the most educated populations in the world with respect to this virus. So therefore, make an educated choice. Make an educated choice about getting vaccinated, because that's what we need to do. And we have the vaccines. So come tomorrow, Monday's a public holiday, Tuesday's a work day, get vaccinated in early August. And by early September, we should be in a position to say that a large chunk of this population has been vaccinated and is in a fairly good position to respond to the virus. If we don't do that, and the virus feeds off the unvaccinated, and the vaccine remains on the shelf, then we have no one to blame but our individual selves. We'll be driving this campaign, and our doctors and nurses and healthcare givers at all levels have not given up the task, and they will not. And the volunteers are out there helping. That's another area we should be proud of. The private sector volunteers have come in, and we'll have more volunteers coming in. I just want to say one thing here in Tobago too. If we have an outbreak in Tobago, like in Trinidad and the nation, and we even put more beds in the hospital, more physical beds, get more bed sheets and more mattresses, that is not going to create any more nurses and doctors and phlebotomists and others. These are specialists who are limited in number. So don't get to the point where you need more beds in the hospitals, because a place to lie down does not healthcare give. The staff that stands at the bedside is married to that bed to be able to give you the care that you need. And that care comes after years of training and a good attitude from those who come by your bedside. These are the facts of 2021. And Minister, maybe we are getting some more people in to support.
Yes.
Could you mention that, please?
Thank you. Thank you, Prime Minister. So as we prepare for the Delta variant, outside of vaccination, we also have to ramp up our human resource. We have brought in 30 more ICU specialist nurses from Cuba. Some will be sent to Tobago to support the Tobago effort. These are specialist nurses not available in Trinidad and Tobago. So we are not depriving any local nurses from their jobs. We have always had a shortage of that. So that is coming in. That is already here, and some will be sent to Tobago.
Thank you very, very much, Minister. I think I've said enough on this issue, and I'm hoping that I can continue to trust the good sense and the reasonableness of a population who from the beginning had been asked to take responsibility for yourselves, because the circumstances require that, notwithstanding what the government does at every level, the taste of this pudding is in the eating at your own shoulder. That's where we're at now. We've progressed to that stage. So please take responsibility and get yourself among the vaccinated. If there are any questions, we take them now. Please identify yourself, and you can go to the mic and we'll take your questions. We have some time. Please identify your media house and put your question.
Hi, good afternoon. Candace Jackson from Tobago Channel 5 News. My first question to you, Prime Minister, is are there any more vaccines to come in? Because I noticed that you didn't give us any update on additional vaccines coming into the country.
The situation with respect to additional vaccine remains the same. We are working on getting additional supplies. I'm confident that we will have supplies. We've gone through July as we did indicate. We had enough vaccines to keep us busy in July. During the month of August, we are expecting some additional vaccines, but I don't want to get into them until we literally have them on hand. We have some potential offers, that's how I put it. But at this point in time, I don't think that the country should focus much on that, because we have hundreds of thousands of vaccines in hand looking for arms, and we have more that are committed to come to us. So we do not expect to run out of vaccines during August.
Okay. And secondly, there's an argument being made to open some of the beaches, perhaps on a restricted basis, like from 6 to 12. That way, you only just have persons that are going for work therapy and so on. And we also know that limers tend to want to go in the afternoon. Or we could even just open beaches that are already manned by lifeguards alone. That way, they can assist in controlling the crowds and whatnot. Because the sector in tourism in Tobago has been, complaining and so on. And pleading for some relief where that's concerned.
I've heard that, but firstly, lifeguards don't organize people on the beach. Lifeguards are there to come to you when you've outstripped your swimming ability. So lifeguards will not be comforting to us on the beach. And of course, if you open the beaches for half day, you can't say it is for John or Mary, because everybody will turn up during that half day period. In fact, if you're going to open it, the longer period, the better, because that will prevent a gathering, because remember, it is the congregating of people that we're against. The reason why we have not opened beaches, knowing the value of being on the beach, the curative value of being on the beach, is because we have opened up so many other areas and taking so much more risk with other people. 45,000 construction workers are out there. They're not entirely protected. They're working with a risk, and you're seeing it in Dr. Hines' chart. And therefore, what we're saying, if we have to give up anything, let's not give up the livelihood. I just mentioned the livelihood of people who are in the retail, who work in the malls and so on. We believe that it is better to hold it so that they can come out as against us going on the beach and spending a while. But I expect that if we keep our downward curve going by behavior, we should get to a point in the not too distant future where we could begin to go back to the places of recreation like beaches.
Okay. My next question is for the Tobago health authorities. We know that the Gamma variant was detected earlier this week. Can we know some details as to when this person would have gotten COVID-19 with the variant, and some details surrounding it, like, you know, how many persons, or how widely do you think that this one person may have affected other persons in the community?
Hi, so what I can share is interesting facts. So the person who was detected to have the Gamma variant was actually asymptomatic, and interestingly was tested as part of the testing to travel abroad, and that's how they were detected. So based on that, we've requested genomic testing around all that person's contacts, but we haven't gotten back the results yet. But when we do, we will share it with you.
Okay. Additionally, when can we expect the ICU care in Tobago to be expanded?
Right, good afternoon. Thank you for the question. Well, right now we are in the process of acquiring the additional equipment, and as the Minister of Health would have said, he's identified some ICU nurses. But in addition to that, we also need certain specialists to come on board to assist us in expanding the ICU service from what we have now. I just want to mention that, if I may, remember in March of 2020, when COVID started, we in Tobago only had one hospital that was not providing anything related to COVID. Then when we had our first ill patient in June of 2020, we developed a modified parallel health system with the medical ward being to treat COVID. And that caused major disruption to the hospital at Signal Hill. Come August, we were able to develop the facilities at the Fort, which was the old hospital that was converted to a COVID treatment center that allowed us to return the medical ward and the Signal Hill Hospital to providing non-COVID and normal services with the development of a COVID ICU then. Fast forward to 2021, where we have added additional facilities to treat COVID up at the Fort. And in addition to that, March last year, we had no facility for testing COVID. Now we have PCR at the Signal Hill Hospital, which gives you a result in about an hour. We also have two facilities for doing antigen testing, one at the Green Room and another one at the hospital. So as time develops and our demand for services increase, we have been so doing expanding the services. And this is just another example. We had forecasted at least a month ago that we would need additional ICU care because the ICU was 80%, 100%, and we started putting things in place to develop that. So we expect in the not too distant future to have the equipment and the staff to expand it. And we plan to expand it up at the fort in the facility that was TREC that has been empty for some time. That should give us an additional 7 beds.
Okay.
Thank you.
Dr. Wheeler, just another question. There are reports, there continue to be reports that there's a significant oxygen shortage in Tobago. Could you give us an update as to, our oxygen status at the Scarborough General Hospital?
Right. The Scarborough General Hospital at Signal Hill has 2 oxygen concentrators that provides all the oxygen, not just for Scarborough General Hospital, all the health centers on the island, and also some of the oxygen at the COVID facilities at the fort. However, in the recent weeks with the increasing demand for oxygen care, we have supplemented that with cylinders being brought up from Trinidad. So there's really no shortage of oxygen on the island at all.
I'll just end it for now.
Thank you.
Good afternoon, Mr. Prime Minister, and also to the panel.
Good afternoon, Liz.
Liz Williams, TV6 News. One of the first questions I want to ask the Prime Minister, I know before there was some talk on social media about a change in terms of the curfew hours. I don't know if we are having daylight curfew or not, so the people of Trinidad and Tobago would like to know if the 9 p.m. to 5 a.m. remains.
Liz, do not take your information from social media. Get your information from the official sources of
That's
Trinidad.
why I'm asking you now. I waited for the opportunity to ask you.
Yes, but that is after the misinformation was spread on social media. Because what we did last meeting of this type, we said publicly that we are not changing the curfew hours for this weekend, it being a holiday weekend. We're not going to do it like we did for the last holidays in June, July, and it would be the normal time of the state of emergency, which we've been having, which is from 9 to 5. No other change. So don't believe anything else. That's the official position. There has been no adjustment to the 9 o'clock curfew and the 5 o'clock in the morning ending of that curfew.
I know you announced already that beaches remain closed, because that was one of my questions. But in terms of barbers, hairdressers, they are asking how soon can they come out, and any facilitation in terms of grants, because some persons are still waiting on their grants. And also, let me just slip this one in one time, in terms of churches. Churches are also asking, and religious institutions, how soon will they be open?
Right. It brings us back to the point. Firstly, it has been confirmed to me that grants are going out, Social Development Ministry and the Ministry of Finance, but there are still some people who are in the line, and we'll continue to service them. And we kept adding, as this thing goes on longer and longer, we kept adding people to it. So that is happening. Unfortunately, it's not going as fast as we would like, but we're making every effort to ensure that help meets those who need it most. And with respect to how soon, when we mention personal services in the earlier part of this conversation, those are the people we are talking about, that we're asking them to get vaccinated. And as soon as we are satisfied that the level of vaccination there is relatively high, and that they're ready, we'll try to give, I would think in another week or two, that those services should be provided, because we want to be comforted that those people are in fact heavily vaccinated because of the nature of the contact that they have with other people. So we have to make sure that that is done. So I'm encouraging them We hear your plea, we know where you are, we know your troubles, but I'd be very happy in the nearest future to be able from this podium to say that you all are coming out. And that's why we're saying this week, we're going to focus on those personal services people in getting the vaccination to them in whatever way we can, so that soon after we can add them to the list of people who are outside. And with respect to the beaches, and we would love for all of us to be out there, but because of what the alternative is, the alternative of having everybody out there doing everything we want to do, is that we could find ourselves, all of us, backing up to a place that we don't want to go. So if we have to reduce the numbers, what we have been doing, and you would have seen this, and I tried to mention it earlier on, but maybe I didn't make that point. We're making the sacrifices in areas, not that you're unimportant, not that you're a non-contributor, but in areas where we reduce we're giving up some leisure for livelihood.
I know that you have been getting these reports in that some employers are now making it mandatory for their staff to be vaccinated, and some are also requesting that a PCR test be done every 2 weeks. What's your view on the matter?
Well, my view is that we all have our problems. The employers who are making those requests of the staff, they have a responsibility, not just to the rest of the staff, but to the rest of the population. And basically what that policy you're seeing there is doing is asking people to assure others that they are not carrying the virus and posing a threat to persons who have exercised their rights in a different way. It's being discussed in the context of your right and your person. But I'm sure by now, you all know that we have always had restrictions on rights and your personal behavior. You know, you buy a car and the car can do, most of the cars in the car park outside can do 120 kilometers an hour. But you know there's a good reason why you aren't allowed to do that. If you go out there and you drive that car at 120 kilometers an hour, you will talk to the magistrate or you might kill somebody along the way. And that is why, even though the car couldn't do it, even though it is your car, the rest of the population says to you, we need to protect ourselves from you and your car. And I think it's the same principle that we have here, that in this case, the safety of the workplace being a responsibility of the employer, and the rights of one worker versus the right of another worker or the public that uses the space. As a matter of fact, I saw something today from a CARICOM country, which shall not be named by me, but it is that for a public servant, for a member of the public to come to a public service office, an unvaccinated person has to call and make an appointment so that they could be treated differently to the vaccinated. And different countries, different people, different businesses are taking different decisions. All I will say is that let us not exploit the situation to the disadvantage unfairly of others, but by the same token, if you have taken a position, there are other positions that flow from that. No man or woman's an island in this matter. And we need to be understanding, and I think we are an educated population, as we are, I hope we are making educated choices.
Just two other questions before Camille comes. The real estate sector is asking that they reopen, and also, I'm sure you have been watching Team TTO. I mean, this morning after 6, Michelle Liahi was, failed to qualify even though she made the mark. But what advice do you want to give to Team TTO in Tokyo at this time?
Well, I think we are being well represented in heart and spirit. And I went to a school here in Tobago, Bishop's High School. and I played a lot of sport there. And we used to play in the adult league, so we very infrequently won. But we played, and our principal would console us by saying every Monday morning, it is not to have won, but to have played the game. And I think Trinidad and Tobago is well represented, and much as we would have liked to be coming home with a basket of medals, those who carry a flag did so with pride, and we commend them for the effort they've made. We are a little disappointed in those new ones who tested positive, but they're being well managed. This being a pandemic year, I mean, we had a couple of our people out there. But as a CARICOM country, we want to join our CARICOM neighbors who have done well and who are representing us, punching well above our weight, particularly the Jamaican ladies who have broken the record there, coming down 1, 2, 3 and flying the Caribbean flag. And therefore, we have not been disgraced. So, you know, I'm a little bit disappointed that Michelle didn't get into the finals, but when you didn't get in by what is 3,000th of a second or something, 1,000th of a second,
Yeah.
that sounds like steel band judging to me. But say what? But she did us proud.
And the real estate sector?
I must tell you, the Ministry of Finance is the biggest advocate for that sector getting back in there, because we're losing considerable income at the Treasury for those transactions. So as soon as the first opportunity we have, for more reasons than one, that sector would be allowed to function. And the Ministry of Finance is the advocate there, and I think I may have to acquiesce to their request very soon. Thank you.
Good afternoon, everyone. Camille McKechnie, Guardian Media. Welcome to the best place in the entire world, you people from Trinidad. I just want to continue a line of questioning that Liz started. Mr. Prime Minister, as a Caribbean man and a former chairman of CARICOM, how do you feel about Jamaica's first, second, and third, the victory in the Olympics, and of Thompson, who has new Olympic record? And also, are you taking notes about the performance of the Jamaicans in relation to the performance of Trinidadians and Tobagonians? And what do you think is the biggest advantage they have over us in terms of facilities and anything else, or training that you can use in order to improve the performance of our athletes?
I don't want us to beat up on ourselves because Jamaica has done well in some areas of Olympic sport. I would simply want to say that all our Caribbean countries, if you follow the Olympics, you see all our Caribbean countries have more facilities than we have. But what they have is a tradition that is now paying great dividends in a world that receives that tradition. The inter-school sport in Jamaica is huge, and has been huge since I was there in the early 70s. And out of that system now comes scouting with facilities on the island. The facilities on the island produce the school-age performers. And if we are failing in any area, it is that area where we don't have the exposure and the competition in the inter-school. If you look at the capacity to do that, we have a greater capacity than Jamaica. We have more secondary schools, we have more top-class playgrounds, and we have more government support in sport. But unfortunately, competitive collegiate system, that is where we've been throwing out these superstars. So that's an area we need to look, but I wouldn't want to give advice from this area to the specialists there. But we do have the potential to strengthen our performance from starting with the school-age competition.
All right. We know that most likely you would have been in contact with the TTOC's Brian Lewis about the...
No, I have not been, so you could stop right there. But I heard the minister saying that she has been in touch with him all the time, and I've heard him on the radio.
So would you be able to say what kind of advice is being offered or what help is being given?
No, I couldn't. I heard the minister saying that she's in touch with him and the team and the management team all the time, and I didn't expect anything else. But from what she has reported, we are as well managed as we could be, and our team is in high spirits, except that we had that little setback. And we do have some people still in the competition. Let's just wish them well.
Okay, this question is for Dr. Parsram. What is the age of the minor who tested positive for the virus that was repatriated? And also, what country was the minor returning from, and what strain of the virus did the minor have?
Okay, thanks for the question. As you know, we try not to give personal level detail for patient confidentiality reasons. So I wouldn't want to say what age the person was. Suffice it to say the person is being well isolated. And of course, the sample was sent across to the University of the West Indies to do typing to determine if there's a variant of concern or variant of interest.
Okay, to the Tobago team, Dr. Hoyt, can you give us a clinical update on the clusters of infections at the male medical ward and the surgical ward and other areas of the Scarborough Hospital? We know that the last time Dr. Thompson spoke, he said that 11 people were infected, 11 patients were infected on the ward, 4 had died, and you had 31 persons 31 staff members being affected.
Thank you for the question. The detailed outbreak with respect to persons who would have tested positive among staff or patients, we do have. I didn't work with the numbers here, but I will provide those numbers for you later on.
All right. Do we have any idea of the Brazilian variant, the number of cases in Tobago, or are we still deciding? Because I know since June 10th, we heard that there were 6 cases of concern and that we were trying to get information since then. We're now almost at the end of July. Is there any additional information that you can give to us?
So from the cases that were previously flagged, we didn't get back any reports that any of them had tested for any of the variants. But thus far, we have definitely flagged an increased number of, well, as I said, all persons who would have been contacts of this known person with the variant. And we have flagged persons who with severe illness, anyone who may have had reinfections, etc. So there's definitely increased testing and genomic surveillance being done.
Well, thank you very much, ladies and gentlemen. We've done a 2-hour session. And I think George hasn't been there yet, but let's have a question from George. And
well, sport expert who went to Bishop's High School in the years when we won. I want to disagree to you that maybe...
I didn't get the first part.
Oh, you didn't get the first part?
No.
Yeah, the microphone is now on. I said as an actual sport expert who went to Bishop's High School during the years when we won, I want to disagree with you and suggest that in fact, technical competency among coaches is the area where Jamaica outstrips us. And people from other countries, including the United States, are now going to Jamaica to train. But that's another story. I think that the Secretary was happy to see you, Prime Minister, here today with the Calvary, the whole group and so on. But you've asked us to treat with the science. And the most basic form of science is arithmetic. And there are some challenges with the Tobago numbers that, as far as I am concerned, have not been addressed. 2 weeks ago, Dr. Wheeler reported that our COVID ICU was full. Today, he is confessing that arrangements are yet to be made for an increase in the number of ICU spaces. The numbers in Tobago are going in this direction that varies significantly from what happens in Trinidad. I'm tempted to say our percentage of cases is higher than the GSC percentage recommended for Tobago in terms of when we look at what's happening nationally. And if you look at even some of the languaging of the releases that we are getting from the TRHA, it is clear to everybody that if there is not an effort to downplay or cover up, at least we've been presented with very nice language, but not clearly an indication that we have the kind of grip that we should have on the situation in Tobago at this point. I have a specific question. Is there any individual who was in the home quarantine who has died in recent times? And if so, what was that cause of death? I'd also like to find out about another circumstance. In the media, we try to share as accurately as possible the information that we provided. It would appear as though somebody screenshot a conversation that was taking place between media members and shared it with certain senior officials. In that conversation, members of the media were expressing some skepticism.
But George, I must stop you here. I think we're drifting off into... No,
well, if I direct that one to the second...
we're drifting off into speculation here now, and I really couldn't entertain that. I was trying to follow you, but you're losing me, because I have no idea what you're talking about. No, but you ask your question. Let me allow the question to be answered first, and then we'll come back to maybe the area you're going down. The question was, whoever in the Tobago Health Department could address that, go to the microphone. But while we're there, I think I want to ask a question, George, if you permit. Is there any challenge that you are making or would like to make with respect to the specific numbers made public today by the technical staff here? Because your analysis seemed to be questioning the integrity of those numbers and the staff. So I'm saying the numbers given here today, are you in a position to question any of those or the technical information supplied?
Well, it says I have with the one question I've asked. That's
okay, well let's get the answer then.
So with respect to persons who may have died, we have one case of someone who was confirmed tested positive for COVID who did die at home while in home isolation. And we have another case of someone who was tested and quarantined, waiting for results, also passed away at home and results came back confirmed. So in total, we've had 2 persons who confirmed positive for COVID who would have died at home.
Included in the numbers presented on your daily reports
yes.
of COVID deaths?
They're absolutely included in the number of COVID deaths. We don't differentiate whether a person would have died at facilities or at home, but they are included.
But there's one other area that I am concerned about, George, in your presentation, and that is you speak about something happening in Tobago unlike what is happening in Trinidad. What exactly are you pointing to that Trinidad is benefiting from that Tobago is not benefiting from?
Not at all. What I'm saying is that if you look at the daily national numbers and you look at the daily Tobago figure, Tobago carries a significant portion of that figure beyond what our population size suggests that we should have. And that's inescapable.
I think that is debatable, George. And again, if you go back to bishops, as you started off talking about our experience in bishops, statistics have a way, you can interpret statistics any way you wish. Because we had one teacher with one student who passed the exam and claimed 100% passes and cried on the other teachers who got 20 and 40 people passing the exam. So statistics could do that to you. But I really want to know, and I want to leave this podium knowing that your concerns are, on solid ground with respect to facts. So if there's any fact in relation to the substance of what has been presented, especially statistical and mathematical substance, then I'm sure that the technical team would want to respond to you. But we've been here for a long time. I only allow another 5 minutes for this, and then we end. Dr. Wheeler, Dr. Hoyt, do you want to respond to Mr. Or both? Yeah, the 2 doctors would respond, and I hope that...
Thank you very much. Just for today's figures, total deaths for Tobago, 43 out of 1,464 COVID positive. gives you a 2.9% death rate. For Trinidad, 1,070 deaths out of 38,557 COVID positive patients, 2.8%. If you take the percentage of COVID deaths, 43 deaths out for Tobago, out of 1,070 Trinidad and Tobago, that's 4%. Same as the ratio for the population. If you consider the percentage of COVID positive patients in Tobago, 1,464 out of 38,557 for Trinidad and Tobago, 3.7%.
Number of positives reported over the last week. How does that figure match up?
So it has been an alarming increase in the number of cases. I think if you all would recall the graph that we had shown, and if you look at the bar graph, where you saw that marked of surge for May and for June, and July is going to be even higher. So let me give you an example. In Tobago, our total number of cases in 2020, at the end of 2020, was 145 cases. Our total number of cases from the 1st of January this year, 2021, to the 30th of June this year, 739. That's 6 months. And thus far, from the 1st of July 2021 to the 30th of July 2021, 10 p.m. yesterday, our total was 617. So yes, there's an alarming increase, and there are multiple factors, one of which is we know that the P1 variant has been introduced, and because there's an increased rate of spread with the P1 variant, you would expect an increase in the number of cases when you have a population that's naive. So that's why you hear the call to arms. If the P1 or Gamma variant is more infectious than the original variant, and we see the numbers that it creates, imagine more the Delta variant has an R naught of 5 to 8. So imagine every person can infect an average of 8 persons. So if you do that math, that is why we're trying to say we need persons to come forward, get vaccinated. The other thing to note is, let me give an example here. One of the clusters we had at a workplace, we had 10 persons who tested positive. 7 of them were from one department. Of those 7 persons, 6 of them had attended a rabbit meat line. So they were there enjoying their rabbit meat, no mask, no social distancing. Thereafter, the other 3 persons who were not part of that department were all social contacts. 2 of them lives with persons who were in the department, and another person is a family member. So when we're seeing spread in workplaces, part of it is because of social behavior outside of the workplace. So what we have is an outbreak of irresponsibility. So at the end of the day, we have a way more infectious variant, and therefore we need persons to make sure and obey the 3 Ws and get vaccinated.
Thank you, Dr. Hyde. And with respect to what Mr. Leacock said and our sensitization to the facts that we're getting, it then makes it very difficult to acquiesce to the demand that we open up Tobago, the bars, the restaurants, so as to get tourism activity. What we're dealing with does not point us to doing that. In fact, Tobago has a great risk. I thought I said that early on. And in small populations like the rabbit meat line, you saw what happened there. So I think I want to adopt Dr. Hoyt's phrase, an outbreak in irresponsibility, and we can get more of that, and the outcome could be quite serious. At this point, I want to ask Dr. Trotman to talk to us with respect to managing COVID at home and managing COVID in Tobago in particular?
Thank you, Honorable Prime Minister. All protocols observed, members of the media. I want to first thank Tobago for welcoming the team. As always, we feel warm and we don't want to go home. We would want to stay longer when you go ahead and vaccinate 100% of your population, and that should be your target. It is important for me to highlight that in reviewing the clinical information, what we are seeing, unfortunately, is that in some instances, people who are at home are not doing or correctly going through isolation procedures. So I'm here to implore that we remember how to isolate at home. It's very important. We must wear our mask at home if we're positive. We must sanitize our surfaces that we use when we are home. And as much as we can, still try to watch our distance when we are at home. Tobago, I want to also underscore the need for the population to listen to what the facts say. You really don't have the support in terms of having massive amounts of healthcare workers in case there's an outbreak. You really don't. And the way for us to avoid that is for us to go ahead and get vaccinated. It is what we have, and it is what we should use. The world has done billions, and the world's record and Trinidad's record is reflecting the same thing. If you are vaccinated, you stand a much better chance. If and when we are vaccinated, we can get all of what we are begging for. What we're really asking for is the return to freedom. Free to do and to mix. Free to be able to get our income up and going. And we can do that if we are vaccinated. We have the vaccines for you. Come and get them. Remember your three W's while you're being vaccinated, but please get vaccinated. Thank you.
Thank you very much, Dr. Hoyt, and Dr. Schwartman, sorry. Thank you very much for those words of wisdom. I just want to emphasize as we close that moving from where we are to a better place and preparing as we must for a threat that's facing us from a variant that could be devastating. We are in a time now ahead of it. Take the opportunity to get vaccinated. We have enough vaccines. I would love to hear from the Minister of Health that we are running out of what we have in hand, because I know we have some more coming, and I expect that August, as we celebrate emancipation tomorrow, I want to wish the nation a reflective emancipation, and part of that reflection, let it be one that sees a decision being made to be a vaccinated person, if you are in the category to so be vaccinated, so that after emancipation, or the period after emancipation, the population of Trinidad and Tobago, by being heavily vaccinated, would be able to respond in a better way to a virus that is already dangerous and to a threat that is out there that could be devastating. Thank you all members of the media for coming. Thank you all for viewing and listening, and we look forward to better days ahead. Thank you very much.